Have you ever experienced having decreased sleep for several days, yet having lots of energy, feeling extremely happy and overconfident, and then suddenly you find yourself sinking into deep sadness, feeling like everything is pointless? Or perhaps you experience weight changes, sleep problems, or even difficulty in making small decisions? If you or someone close to you is troubled by any of these issues, then this video is for you. Hello everyone, my name is Dr. Syeda Quadri, and I am a psychiatrist. I have been working in this field for the past 15 years. Today, we will explore a very important topic, bipolar disorder. This is a disorder that is often misunderstood, so let's explore it in detail. Let's start. Bipolar disorder, previously known as manic depressive illness, is a mental health condition characterized by unusual shifts in mood, energy, activity levels, and concentration. These changes can create difficulty in carrying out everyday tasks. There are three main types of bipolar disorder. All of them involve significant changes in mood, energy, and activity levels, ranging from extreme highs, mania or hypomania, to very lows, depression. Less severe manic periods are called hypomanic episodes. Let's move to the next point where we will learn about its types. Bipolar disorder has several forms, each with unique patterns of mood episodes. These include Bipolar I disorder. This includes at least one depressive episode and one manic episode. Bipolar II disorder. This includes at least one depressive episode and one hypomanic episode. Cyclothymic disorder. This is a milder form where there are frequent hypomanic and mild depressive episodes for at least a 2-year span. Other types of bipolar disorder are due to drugs, alcohol, or medical conditions. Now let's go through the symptoms. Basically, bipolar disorder consists of depressive and manic or hypomanic episodes. So let's first look at the symptoms of mania. These are the symptoms one may have during a manic episode. 1. Elated or irritable mood. Elated means either intense, extreme happiness, often leading to euphoria. 2. Increased energy and activity, feeling more energetic and active than usual. 3. Elevated self-esteem or grandiose thoughts. By elevated self-esteem, we mean inflated sense of self-confidence, sometimes to the point of feeling invincible. Grandiose thoughts means feeling sense of entitlement. For example, thinking that you are the king or queen of the universe. 4. Reduced need for sleep, feeling rested with very little or no sleep. 5. Pressured speech, talking very fast and switching topics quickly where others finds it hard to keep up with you. 6. Racing thoughts, having fast thoughts, making it difficult to focus on one thing. 7. Distractibility, getting easily distracted and finding it hard to concentrate. 8. Impulsive and risky behavior, engaging in risky behaviors like spending sprees or reckless activities. A manic episode can be so severe that you may lose a sense of reality. One often needs to be hospitalized during a manic episode. One may have psychotic symptoms during a manic episode, which means you may hear or see things that others don't, and your thoughts may be disorganized. Hypomanic episode is a milder form of mania, where one is able to function and no psychotic symptoms are present. Symptoms of depressive episodes. 1. Severe sadness, feeling deeply sad or hopeless. 2. Loss of interest or pleasure, losing interest in activities once enjoyed. 3. Changes in weight and appetite, significant weight loss or gain and changes in appetite. 4. Sleep problems, issues with sleep, waking up early or sleeping too much. 5. Fatigue and low energy, feeling excessively tired and lacking energy. 6. Difficulty in decision-making, trouble making decisions and concentrating. 7. Thoughts of suicide, thoughts of death or suicide, or attempts of suicide. 8. Persistent feelings of guilt, worthlessness, or hopelessness, always feeling guilty, worthless, or hopeless, which damages self-esteem. These were the main symptoms. Now let's see what the causes are. Bipolar disorder can have several causes, including genetic, biological, and environmental factors. Genetics plays a major role if there is a family history. Biological factors include differences in brain structure and functioning. Environmental factors such as stress, trauma, and substance abuse can also exacerbate the onset or symptoms of bipolar disorder. Now let's come to the most important point. Can it be treated? You will be happy to know that there are treatment options available. Let's explore them one by one. The treatment of bipolar disorder is done by a psychiatrist. So let's see the treatment options. 1. Medications. Medications are essential for managing bipolar disorder. They stabilize mood swings and address manic and depressive episodes. Common medications include mood stabilizers, antipsychotics, and antidepressants. 2. Psychotherapy. Therapy options such as cognitive behavioral therapy, interpersonal and social rhythm therapy help patients manage their symptoms, develop coping strategies, and maintain a stable routine. Family therapy can also be beneficial. 3. Other treatments. For severe cases, treatments like electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS, may be used. These treatments are considered when medications and psychotherapy are not effective. These are some important points through which bipolar disorder is treated. I hope this video will be very helpful for you. It's very important to understand bipolar disorder and seek treatment for it. If you or someone you know may be experiencing these symptoms, do not hesitate to seek help. Also, spreading awareness is our duty. I hope you liked this video and understood bipolar disorder well. If you think any points are missed in the video, let us know in the comments box and share your strategies. Your health is important to us. Thank you.